Hello everybody, this is your lecture on 60s liberalism, the domestic policies of JFK and LBJ. Um, so the kind of slogan for Kennedy's uh, election campaign in 1960 was a new frontier, and you should be able to remember that from his inaugural speech where the new frontier was both exploring the stars and the wonders of technology and space, but also using technology and leadership to solve domestic problems at home, like eradicating hunger. And the Great Society programs I haven't talked about yet, but that was the nickname given to Johnson's policies, um, anti-poverty. Um, so they were president 61 to 69. Kennedy was 61 to 63, and then Johnson took over that term after Kennedy was assassinated, and then ran for re-election in 64, served one more term, but didn't serve after that. Presidents Kennedy and Johnson, and their New Frontier and Great Society programs, especially the Great Society, were the kind of civil rights and anti-poverty legislation and the programs that resulted from them. Before we get into it, though, kind of need to review the terms conservative and liberal. They're used all the time, complicated words. Conservative is often identified with the Republican Party, although that party is in a lot of flux right now. Liberals are often identified with Democrats, but again, there are different groups under the Democratic Party. There's the kind of Bernie Sanders wing, more liberal, and the more moderate wing of kind of Hillary Clinton and Barack Obama, somewhere in between the two of them. Nowadays we talk about red states and blue states. Red states being conservative states like, say, Texas. Blue states being liberal states like, say, New York or California. That identification of red and blue is pretty recent. It only came into being sometime in your lifetime when they started to color things red for conservative, blue for liberal. Also, the elephant is the symbol of the Republican Party. The donkey is a symbol of the Democratic Party. There are kind of two uses of the term conservative and liberal. There can be an economic definition and social. For economic, how do you feel about the government taxation and spending and the amount of government regulation? For social, it's laws about behavior. To figure out if you're conservative or liberal, you can kind of ask two basic questions. And I'm oversimplifying, but just so you get the idea. Now, is the world fair? A conservative would generally answer basically yes, that the world is full of opportunity and you get what you work for, you get what you deserve. A liberal is generally going to answer that the world is often not fair, that corporations and the rich and the powerful have advantages and can take advantage of those who don't have that money and power, workers, the poor, and that certain groups need help and that government is needed to battle against those who have more advantages. So on this issue, you can be a fiscal conservative or a fiscal liberal, and fiscal has to do with government budgeting and spending. So the Republican Party generally wants less regulation, wants less spending, and lower taxes. Military spending might be the exception to that. A Democrat or a liberal will generally want more government programs and is willing to nobody likes taxes, but is willing to put up with more taxes, and thinks more regulation is needed to, say, protect the environment, whereas a conservative would be more concerned with, well, are the regulations strangling jobs and making it hard, strangling businesses and making it hard to hire people for jobs. Then there are laws about behavior, and I kind of simplified that to, should the government enforce what is wholesome and moral? Should the government tell people what they should do with their behavior? And a conservative would generally answer most definitely, or at least a social conservative. So they have ideas. They have ideas about what um, the government should regulate in terms of people's behavior in their private lives. And a liberal would answer, say, no, I don't want the government regulating people's behavior except for maybe guns. And then a big history recap, very quick. In the 17 and 1800s, American government policy was almost completely laissez-faire. You're on your own, what we would today call a conservative philosophy. And in the 1900s, there was a shift to a more active, more liberal government. Three shifts. In the early 1900s, what do we call that era? Right, the progressive era, in response to industrialization and the growth of giant corporations and the exploitation of workers. In the 1930s, of course, the New Deal in response to the Depression, and the big liberal legislation out of that would have been, among many things, Social Security. And then in the 1960s, the kind of Great Society programs in response really to American affluence in the post-war period, late 40s, 50s, 60s. The thinking was, well, what are we going to do for the people who haven't been a part of this? And then, I've already mentioned this in class, but in the 80s and 90s, a kind of a conservative resurgence. There's often a book associated with a shift in thinking. In the progressive era, the leading book would have been How the Other Half Lives by Jacob Riis, along with some of the other ones that you already know about. In 1962, a less well-known book is The Other America by Michael Harrington, talking about poverty in the United States as America had become more affluent. We talked about the rise of middle class, the rise of living standards, suburban America. Harrington noted that in the urban big cities and in rural areas, many people have been left behind and we're not prospering like middle class America. Here's an outline, a little bit on JFK, but most of this is on LBJ and his Great Society programs. He had something called the War on Poverty, VISTA, HUD, Job Corps, Head Start, Medicare and Medicaid, and the Legacy. I'm going to cover separately the civil rights movements in the 1960s, which is also kind of part of the Great Society. JFK. JFK, as I've already mentioned, was part of the kind of last great idealistic phase of American history. His administration was often called Camelot after King Arthur because of kind of the style and awesomeness people felt of the administration. One of the things that he mentioned in that inaugural speech, that ask not what America can do, what your government can do for you, but ask what you can do for your country, was an emphasis and a surge in volunteerism. He established the Peace Corps overseas, you know about that, and he pushed for more volunteerism at home, and that is going to result in a surge of kind of idealistic people joining government service or community service to kind of help improve society. And there's still people who believe in that. There's, but I think we are much less idealistic as a society than we were 60 years ago. He also does a beginning. He does a number of social welfare programs. I'm not going to give any names, but he increases funding for welfare. He increases funding for food stamps. He increases funding for education from the federal government. Something called, well, I'll get back to that. And so he definitely makes a beginning and has plans for more before he is assassinated, which leaves the bulk of the work for Johnson. And this is really where, other than the Vietnam War, Johnson leaves, well, and civil rights, where Johnson leaves a great mark. This is a quote from one of his speeches. "And with your courage and with your compassion and your desire, we will build a great society. It is a society where no child will go unfed and no youngster will go unschooled." There are famous quotes attributed to, I think, Gandhi, that we judge a society by how they treat the most vulnerable among it. And in the 60s, America kind of took that to heart. Lyndon said he was going to declare war on poverty. So like we were making war on communism. And I'll start with 4 programs. The Job Corps was these are all federal programs, national programs, was a program to give training to economically disadvantaged youth, maybe 15 to 25, for specific job skills. It kind of give them really needed training for the workforce. It still exists. Bethlehem actually has a Job Corps site. If you go out to Glenmont, there's a Glenmont Job Corps. But it is much reduced in scope and emphasis than what it was in its heyday in the 60s. Head Start is probably my personal favorite program of the Great Society programs. What researchers in the 60s noted was that poorer children were starting school in first grade already behind and never seemed to catch up to their suburban and middle class peers. And so the idea was to start spending on enrichment programs and nutrition programs for preschool. And it is, I think, underfunded, but probably one of the most cost-effective programs still in the government today. It's still going, and the money was spent in both, again, urban areas and in rural areas. And preschool kids could come in, get some playtime, but also, start to, through games and play and story time, start getting into reading, or at least learning the alphabet and numbers a little better, learning how to socialize, and then get a good meal. That's Head Start, still around today. Vista was the domestic equivalent of the Peace Corps. So it's the Volunteers in Service to America, and it is no longer a thing, but in the 90s we started Teach for America, which is maybe the most similar equivalent. So Vista was doing community service paid for by the government, not very good salaries, here in the United States. And then HUD was a new cabinet department, Housing and Urban Development. So it was focused on the cities, and it was kind of slum clearance and spending on slums to build more housing and more opportunities. Out of all of them, I think that's probably the least successful of the programs. There is no HUD department anymore. It's been, actually there might be, but it is much reduced in scope. It's now, there still is, I'm sorry, it's what Ben Carson is head of. And that program, then spending in the 60s, became tainted because it was, a lot of the projects were huge public housing projects that we would call, kind of the projects now, and they became, they weren't very well built, and they were kind of isolated from the rest of the community, and they ended up becoming not great places to raise kids. A lot of crime and a lot of drugs, and people tried to avoid getting out of them. When we build public housing now, we tend to make it more like just housing that people would want to live in, a little more spread out, little lower scale, not these 30-story high-rises, and with shops and other thing around it, so it's more part of the community. So those are the kind of 4 big projects in the war on poverty. Healthcare was a huge focus of the Great Society programs. And I'll just detour for a second and talk about how in America public education is considered a right. Everybody has the right to a free education, but healthcare is not really considered a right, although we came very close to it with Obamacare. We've never really adopted that idea that everybody should have kind of good access to healthcare the way maybe say European countries have, or Australia or New Zealand or Japan. But in the 60s, Lyndon Johnson added two programs, sorry. The first and the biggest being Medicare, government-funded medical care for the elderly. Initially, it was very controversial. The AMA, the American Medical Association, opposed it, called it socialized medicine. But now, of course, it's become an intricate part of the services the government is supposed to provide. So this is when you turn a certain age, 62 now, it didn't start at 62, you can get, the government will pay for your health care. It is what's known as an entitlement program. And an entitlement program, people misunderstand this, but that means that everybody is entitled to it. You don't have to be at a certain low income level to get it. Everybody gets it. Even wealthy people can have Medicare if they want it. We have two big entitlement programs, meaning programs that everybody is eligible for once they reach a certain age. Social Security is one, Medicare is the other. The second thing in terms of health care that Johnson added was Medicaid, which is government-funded medical care for the poor. And Medicare and Medicaid have kind of taken different paths. Medicare has become something that people very much rely on. It's very popular, and it's almost unthinkable that we would get rid of it. Medicaid, because it's not for the middle class, it is, you have to be below a certain income level to qualify. It's less popular and has been kind of downsized over the years, and is often something that politicians want to chop. One of the legacies of the entitlement programs is they have gotten bigger and bigger. So you notice now, this is total spending in a recent year. I think it may have been 2016. It's almost $4 trillion by the government. A chunk of that is about 16% is defense. There's some non-defense spending, which actually isn't very much. Unemployment compensation down here, and benefits for government retirees and veterans benefits. And then you see the three kind of giants of the federal budget. Medicaid is about 370 billion right now, so it's, I'm going to guess it's somewhere between, well, it's right about maybe 9% of the total budget. And then Medicare and Social Security take up just a ridiculously large portion of the budget, almost $1 trillion alone for Social Security, and as much as the defense spending for Medicare. Note that Social Security pays for itself. People, payroll taxes, if you work, you put payroll taxes in, and that money is used to fund retirees in their retirement. The reason this has become such a big deal, and these numbers are so huge, is of course the baby boom. When the baby boom was younger and in the workforce, there were a lot of people working and not as many retirees, and it was easy for the current workers to fund the current retirees back in the 60s, 70s, 80s, 90s. But as the baby boom has aged and is now starting into retirement, or well into retirement, they're drawing out more than the current workforce can pay quite so easily. So we are heading towards a crisis in the future. I'll have more to say about that prior to the Regents exam, but I'll give you a basic idea. In terms of the legacy, the Great Society has kind of a mixed record and a mixed reputation. Head Start has a generally pretty good reputation, and it's kind of, they say preventive spending is better than spending after the fact. You can spend on Head Start, or you can spend on food stamps, welfare, prisons later, and so preventive spending tends to be more effective, and I think Head Start's generally well thought of. HUD has not as good a reputation. Medicare has, like I said, become a critical part of the services that government is expected to provide. It's often that and Social Security are often called the third rail of American politics. In a like a subway or something like that's electrified, you have the two rails that the wheels of the subway car run on, and you have a third rail, which is the electrified one. If you touch it, you get electrocuted. So when they say something is the third rail, they mean don't touch it because it'll be political suicide. In general, the entitlement programs, Medicare, Social Security, have much more popularity than the anti-poverty programs. People have over time started to think less about, hey, it's our duty to help people out who are less fortunate than us, and more like, I don't want lazy people kind of leeching off my tax dollars. And you can take it with, that's more of an opinion thing. I'm not going to express an opinion there. Another kind of after effect of the 60s was that all the spending that Johnson had to do on the Vietnam War, the bombing, the soldiers, etc., became huge unexpected expenditure, kind of got in the way of the spending he wanted to do on the Great Society programs, and so they never really got the funding that he intended or maybe they needed. In the later decades, especially starting in the 80s, there was a backlash, a conservative backlash, with the Reagan Revolution, and some of this, although not all of it, was undone. And I'll just end with the last thing is that to contrast the U.S. versus other developed countries, Western Europe, Japan, Australia, New Zealand, we have a different take than most of those other countries. England is kind of like us. We tend to leave people on their own a little bit more. We have less social welfare spending than those other countries. If you look at France, Germany, the Netherlands, Japan, New Zealand, Australia and England less so, they all provide much more on the way of this kind of liberal spending than we do, and giving people a hand up. And that's not to say, well, almost sneezed, that they're right and we're wrong. It's just we chart a very different path. We're much more on freedom, leaving people alone, and they're more on, well, we need to take care of people. All right, that's it for the lecture. I do not know how long I went. I'm going to stop it and I'll find out. Hope you're good. I'll see you in class.